So welcome everyone to today's session on digital health citizenship, advancing digital health and civic literacy through intergenerational dialogues. This session is part of Global Public Health Week, and we're super excited to have everybody here, both participants and speakers alike. And we hope that this session is really a dialogue that aims to, get input from the speakers and the attendees alike. So we're very excited to see how this develops. My name is Whitney Gray, and I'm the Youth Engagement Coordinator of the Digital Transformations for Health Lab. And I'm meant to be joined by my partner, Alessandro Baroni from the Young World Federation Public Health Association. But in the end, he's not able to join with us, so I will pass it over in a little bit to his colleague, Andrea, who can give us a brief introduction of the Young World Federation Public Health Association. Let me just stop that so we can just talk a little bit. So today, really the goal is around enfranchising young people to co-design and critically engage with digital first health systems. This is a core project of the DTH Lab as efforts to increase public participation and digital health citizenship more broadly. By partnering with youth and youth-led organizations, at the global, regional, and country level, the DTH Lab is launching an assessment of young people's perception of digital health citizenship to support the co-creation of desired health outcomes, promote youth leadership, and support a generation of informed and enfranchised digital health citizens. So as I said, we're really excited about today's session. It's one of many that kicks off the series of intergenerational dialogues and debates that the DTH Lab will host over the next year in collaboration with youth-led organizations such as the Young World Federation Public Health Association. And I'm really excited to see how our partnership develops in this space as we really try to create more of an environment for young people to directly call on different decision makers and stakeholders in becoming digital health citizens. So a few housekeeping comments. Since this is an informal meeting, we've left it so that we're all joining together, but I hope that all of the participants can keep yourself muted until the Q&A session, where you will be called upon by the moderator to raise your questions or concerns for the speakers. We'll also flip back and forth between some slides, but we really hope the majority of the call will be kind of in this setting with videos on. Although we ask the participants to keep yourself muted, if you feel free to turn on your video so that we can all see each other if that's a possibility given connection issues. And I think, just a general sense of, if you've got questions, add it into the chat. Feel free to introduce yourself and where you're coming from and kind of the reason maybe why you're joining this call. We will have some Slido polls throughout the discussion that get a little bit of information, but it's always great just to welcome everybody. So moving forward, I'm going to say just a little bit more about the DTH Lab to provide kind of a framing of the session in general. I will then hand it over to our moderator, Andrea, who will welcome the group as his role as Young World Federation Public Health Association, and as well as my colleague Tamiwa Akansanya, who is the project coordinator for the DTH Lab and has been leading a lot of these efforts for this event. Then we'll get started with kind of a fireside chat and hear from different speakers on particular questions that we found really interesting that we want to hear more from them. Then we'll go through a short kind of plenary Q&A where we really hope the participants, you can chime in at that time. And then we will share some findings from a scoping review from the Young World Federation Public Health Association, and then launch a very exciting thing that I will build up the momentum and wait till the end to talk about more. But we hope that you all stay with us until the end so that you can have the sneak peek of what we're launching today at the end of the session. So I think that we're already a bit at time, so I'll try to be quite brief. I think most people are aware of what the DTH Lab is, but as a global consortium of partners, we're working really across generations, sectors, and geographies to drive implementation of the Lancet and Financial Times Commission on Governing Health Futures. the recommendations really called for a value-based digital transformation for health co-created for young people. So through cutting-edge research, strengthening youth leadership, driving innovations and policy and practice, the lab really focuses on three main areas of work. Just to be quite brief on those, they are supporting digital health citizenship and youth creation of digital first health systems, advancing value-driven governance of the digital transformations for health, and addressing the direct and indirect ways that digital transformations influence equity in health and well-being. So the lab works at a global level with particular focus on countries with large populations of young people. These are predominantly situated in Africa and Asia, which is also where the consortium partners' offices are, both in Nigeria and India. And as the youth engagement coordinator, I really work to include young people at every stage of work for the lab and in meaningful ways. So I just wanted to mention that there are several access points that young professionals that are passionate about digital transformations for health and co-designing a future where young people can flourish. You can kind of partake and be part of the lab in different ways. So we have different partnerships with various organizations, including the one that you see today with the Young World Federation Public Health Association. We have a My Health Futures Youth Network that I will share the link to in case anybody would like to join. That network now has over 300 young people. And then we also have the cohort of regional youth champions, and I'm very excited to be joined by one of my colleagues today, Iman, who's representing Northern Africa. And then we're also going to launch soon, or it's already launching, a bit of a technicality there, is around the fellowship programs for research that we'll have both in Nigeria and India. So thank you, all of you, for joining today. I'd like to hand it over now to Andrea, who can give us a brief introduction of the Young World Federation Public Health Association, and also then to Tamiwa, who will both joint moderate this session to follow. Thank you very much, and over to you, Andrea.
Thank you very much, Whitney. It's a great pleasure for me to be here. I'm Andrea Causi. I'm a medical doctor, and I am the lead of the digital health project at the young group in the World Federation of Public Health Associations. As you quickly mentioned, the young group at the World Federation of Public Health Associations is a dynamic group of young public health professionals from all over the world. We have several hundred members, and we are active on a number of projects. Here on the slide, you can see our last group meeting in Rome at the World Congress of Public Health in May 2023. And I'll be joined later by Maya Ferfer, who is an esteemed public health professional in Canada, who's going to be presenting one of our most recent activities. And this was it for me, and I'll hand it over to Tomiwa to introduce herself.
Thank you so much, Andrea. That was very well spoken. Thank you, everyone, once again for joining in. My name is Tomiwa Akinsoya, and I am the project coordinator for the Digital Transformation for Health Lab. This topic is one that really excites me, and yes, I'm someone who's very passionate about leveraging digital technologies to advance youth health in Sub-Saharan Africa and globally as well. So first and foremost, it's important to highlight the aim of the intergenerational dialogue that we all are here today for. Yes, it's at the end of the day, it's important to note that the aim is predominantly to assess the current perception of digital health citizenship with a particular focus on gathering youth insights and their key asks in becoming more enfranchised digital health citizens. And so during the course of the event, you'll be seeing some Slido polls. You will also have, we'll also have the launch of the DTH Labs Digital Health Citizenship Survey, and the Young World Federation of Public Health Association would also be delivering a presentation specific to the dialogue that we're having today. So first off, before we move into the dialogue, we would like to hear from everyone here, all of our participants, on what essentially do you believe is the meaning of digital health citizenship. So I'm going to be sharing my screen with a Slido poll. It's going to take about 2 minutes of your time, so please kindly keep the time as well. So we just want to know what generation you're from. Since it's an intergenerational dialogue, it's important that we all know what representation of generations are on this call today. So just leave about 2 minutes of your time to kindly take on the poll, which will also be sharing some of your responses during the course of the program. So yes, you're all on a timer at the moment, so please feel free to head on to the poll and put in your entries. The questions, like I said, are around one, what does digital health citizenship mean to you? And the next one is on what generation are you from? So yes, I can see a number of faces on the call, so I can particularly picture that we're a number of millennials here, but it would be great to know where everyone, what generation everyone is from. So just take about like 1 minute more so that everyone can submit their responses, and then we proceed with the program. Thank you. All right, then. So moving on into the dialogue. First and foremost, we just want to say thank you to all our speakers for being here today. Thank you so much for taking out your time. And yes, it's very exciting to have everyone on the call here today at the moment. So first off, I would like to bring on board Iman Lakwashi. So Iman is a regional youth champion at the DTH Labs. She's also the director of network engagement at IWAFP and the founder of Concealed Narratives. The Concealed Narratives is a local youth-led initiative using digital advocacy and storytelling to raise awareness around women and girls' issues in Morocco. So Iman, it's a pleasure to have you. Thank you for joining us. And we just want to ask you, pose a question to you. In collaboration with the Leadership, Empowerment, Employability, and Diversity Initiative, Concealed Health Initiatives conducted a Women-Town project in the MENA region. I would like to ask, what knowledge gaps or needs in the field of digital, civic, and health literacy among women and girls in Morocco led to the initiation of the Women-Town project with Lead in the MENA region? Over to you, Iman. Thank you.
Thank you so much, Tamiwa. I'm very excited to be here. Hi, everyone. Again, my name is Iman. I am from Morocco. So for the Women-Town project, it is one of the projects that Concealed Narratives is a part of, along with other organizations in the MENA region. It is a research and a consultative project, basically, that was launched just recently with co-partners in Iraq and in Lebanon. So the goal is to conduct several focus groups and roundtable discussions with young women and girls to understand the challenges that basically hinder their empowerment in the MENA region. Through these insights, what we hope to do is to develop policy recommendations that will be shared with various stakeholders, including policymakers, government officials, and our hope is to inform the development of targeted programs designed or to address those specific needs and challenges, and to contribute to the achievement of the United Nations Sustainable Development Goals, specifically goal number 5, which is gender equality, and goal number 8, which is decent work and economic growth. So for the initiation of this project, it was driven by several critical knowledge gaps. So for example, the lack of information and data available for young women and girls in the MENA region. They face a significant barrier. I mean, that is in itself a significant barrier to their independence and autonomy, and the lack of access to opportunities and resources is unfortunately very big, and it hinders their ability to make informed decisions and advocate for their rights effectively. What we noticed as well was that a lot of women and girls have limited awareness of, for example, how policies are developed or how they are implemented, or how they can also influence or maybe participate in that process. And this limits as well their ability to advocate for policies that reflect their needs, that reflect their interests, well-being, etc. Of course, when we talk about digital literacy, we have to address the limited access to internet and connectivity in some remote or rural areas that significantly impact the women and girls' engagement in digital health citizenship. This limitation, unfortunately, not only restricts their access to reliable health information, for example, but it also affects their access to educational programs and services. It limits their advocacy opportunities. It prevents them from raising awareness about the issues that matter to them the most, and to influence policies. I would say last but not least, another gap that was identified is the lack of support systems or networks that are available that can provide, for example, mentorship and guidance and encouragement, and that can really help these young women and girls navigate all these different challenges and build their confidence, for example, and develop essential skills for success. Thank you. Over to you, Tamil.
Thank you so much, Iman. Very well put, to be honest. And I think one of the things that I picked up from your conversation is the area of policy gaps. And I know that implementation of policies are essentially one of the pivotal requirements that governments are supposed to uphold. So to that effect, what current governance approaches do you think, or rather are you aware of, that are currently being utilized in Morocco to ensure that women and girls become enfranchised digital health citizens?
Of course, so for example, in Morocco, there are various governance approaches that are in place to ensure that women and girls become more and more engaged as digital health citizens. One of the key approaches would be the implementation, for example, of the National Digital Health Strategy, which serves as a roadmap for leveraging digital technologies to enhance healthcare services and promote health literacy. And this strategy includes initiatives aimed at increasing access to health information and to streamline that process through either digital platforms like mobile applications and online portals. Another approach or strategy would be the growing emphasis and focus on integrating digital health education into school curricula in itself by incorporating different digital health topics in educational programs. Morocco is ensuring that young girls are exposed more and more to essential concepts related to digital health citizenship from an early age. This is a proactive approach that not only promotes health literacy, but also empowers them to take charge of their own well-being. Last but not least, when it comes to civic engagement, one key strategy is the establishment of various youth forums, conferences, and platforms, as well as youth-led organizations that provide young people, including young women and girls, with opportunities and information on how to engage in civic activities and voice their opinions on issues that affect them the most.
Thank you so much, Iman. It's great to see the initiatives that the government of Morocco and the MENA region utilizing to advance digital health and civic literacy. So thank you so much once again. Now, speaking on health literacy, I would like to pass the baton over to Christine Sorensen. Now, Christine is the first president of the International Health Literacy Association and the executive chair of Health Literacy Europe. She's a thought leader and is totally committed to advancing the global state and scope of health literacy. Thank you once again for joining us, Christine. I would like to ask through the Christine Sorensen Health Literacy Trailblazer and Health Literacy Powerhouse programs, what are some recommended best practices for fostering health literacy among young people and within government structures? Over to you, Christine.
Yeah, thank you very much. So when I hear this bio, it sounds very impressive, but actually my journey started 30 years ago when I was a youth representative at United Nations for the World Association of Girl Guides and Girl Scouts. And I was also studying medicine. And in that capacity, I was planning and hosting the World Youth Forum of United Nations, one of the first ones. And it was so impressive. So it kind of turned around my whole career path. So moving from medicine into public health and taking the degree in public health, and later moving from Denmark to Netherlands and doing a PhD in health literacy. And while I was also a coordinator of the European Health Literacy Project. And at the core, it was all about developing people's health literacy and people's skills and people's potential. And I think that was also what really taught me from the beginning when I started my youth engagement. I wanted to promote the rights of girls and young women. I wanted to promote the opportunities for getting education and better health eventually. And so those values are still the same now, 30 years later, when I try to speak to governments about health literacy. So health literacy is a bit of a technical term, but basically it's about the knowledge and motivation and competencies to manage your health and well-being and help shape your communities. So all of what we just heard, also Iman, for example, was giving us a very nice example from Morocco. But unfortunately, as you know, it's not every government that takes health as a political choice or health literacy as a political choice. I'm still wondering, for example, why we don't have health and well-being as a subject in school. It's always like an add-on project-based approach. We don't have teachers apart from physical education, which is, of course, important enough. But in my dream world still, I really hope that in the future we will have schools where health and well-being gets a place in the curriculum as a subject, like geography and biology and math and language and so on. I think this is the starting point. This is the mission I'm on. And this is why we've developed the International Health Literacy Association. And I'm very proud, of course, that we also have a youth representative in our board. We have what we call Council of Explorers. So these are for young professionals and newcomers in the field, no matter what age. But making sure that there is a youth voice in the decision-making body of the organization. So as a health literacy kind of expert, we try to share this value of making sure that people have access to the information they need to take informed and shared decisions. And not every government is making sure that is available. Not every organization, not every hospital, not every clinic makes sure that digitally the information is available for people to make appointments, for example, in a timely manner, making sure that information is available for them to take decisions when they're ill, when they're at risk, when they try to stay healthy. So this is the idea of promoting a health literate citizenship, to make sure that people have actually the knowledge they need to also take action. Over to you.
Thank you so much, Christine. Thank you so much. That was still very well said. And one of my take home from that is what you mentioned about competencies and ensuring that people and young people essentially have the competencies to manage their health as an individual, especially even in the digital realm. With that said, I think we can move to Sandra, who at the end of the day, I am very much aware that when we're looking at digital competencies with regards to risk to safety, privacy skills, and information quality, I'm aware that she's very well versed in that field. So thank you so much, Sandra, once again, for accepting our invitation. Now, everyone, Sandra is a fellow and director of youth and media at the Berkman Klein Center for Internet and Society at Harvard University. She is responsible for coordinating youth and media policy research and educational initiatives, and is leading the collaboration between the Berkman Center and UNICEF. Thank you once again, Sandra, for joining in. Now, as the director for the Youth and Media Project, how would you say has the Youth and Media Project leveraged evidence-based insights to enhance responsible digital health citizenship among young people in the digital space?
Thank you so much, first of all, for the invitation, but also for the question, which I think you started with the perfect question at the very beginning, where you asked us kind of what generation we belong to, which made it very clear that I am part of the older generation here, which makes me feel terrible. I'm not that old, but I think it's a good segue into how I wanted to start. So I lead a research project based at the Berkman Klein Center for Internet and Society. As you just said, it's called the Youth and Media Project, also based at the University of Zurich. But so what do we do at Youth and Media? We do research globally. We apply diverse methods, so quantitative and qualitative methods. We do a lot of field work in countries where we speak the language and know the cultural context there. And in other countries, we rely on organizations such as UNICEF or other local organizations to do the research in partnership with. But I would say two big learnings or two main takeaways from this. One is we're looking kind of at the whole spectrum of issues. So I think it's important to talk about some of the challenges or the risks we see kind of in the digital space. But I think it's equally important, particularly when you talk to young people, to look at the opportunities. So to have a balanced approach, I think, is key. Also, when we talk about health. But the main takeaway has been that we need to do research in partnership with young people. I am getting older as I started, but for me, it's truly at the core of the Youth and Media Project is that we do participatory research, and that meaning that we kind of work with young people, not just treating them as objects of study, but really create a partnership throughout the research process, an equitable partnership, and in most cases even try to co-design the research process itself. So what methodologies are we using? How do we frame the issue? What kind of where do we want to do the field work? And then most importantly, we also look at the data together and write reports together. But I wanted to give you not just leave with kind of a theoretical observation on how we do our work. I give you a specific example. A couple of years ago, we were sitting in our office, again, participatory research, so young people and older people sitting in one office, having a conversation about Instagram. And so the older person says, well, how does your Instagram look like? And asks essentially one of our youngest team members. And this youngest team member opens the Instagram, and it's a nice profile, has a picture, and had 3 photos on their Instagram. Older person and me, we open our Instagram, it has 300 pictures. Mine, the other older person, also has a lot of pictures on their Instagram. So the older person says, well, it must be that you're not very digitally literate, or you're not using Instagram a lot because you have only 3 pictures. And so the young person looks very surprised and says, how do you even make that assumption? I am super into Instagram. I just use it very differently than you. And I am actually very, very digitally literate, which is true. And so that essentially then triggered a whole research project where in partnership with young people, we studied what the digital skills are that young people need or should have kind of to thrive in a digital space. We wrote a whole report called Youth and Digital Citizenship Plus, where we essentially mapped 17 areas of life across which young people benefit if they have digital skills. So essentially, my main takeaway of this is we do at Youth and Media research across topics, including health, but the most important thing of it is to really do it in partnership with young people. That's the core takeaway. Maybe I leave you here.
Thank you so much, Sandra. I think what I learned, especially with Berkman Klein, is how you utilize the interconnection of digital health and civic literacy to enfranchise young people to become great digital health citizens. And so it's really important that we critically engage young people in co-designing what they imagine to be their ideal digital health ecosystem, essentially. As a follow-up to that, I mean, you've had engagement with different researchers, like you have mentioned. What lessons have you learned, or what lessons have been learned from the project that could benefit other initiatives that are focused on youth engagement in the digital media space?
Maybe three, kind of as a hopefully builds on what I said earlier, three main lessons. One is, while there is often not a lack of research or evidence we could draw from, one takeaway has been that we often use very different terms to talk about specific issues, and that makes it a challenge across kind of generations to really debate on these issues. I give you an example. From my work, we have done a lot of work around privacy, where it turns out that young people actually very much care about privacy, but they have a very different conceptual understanding of privacy. So when you ask a young person about privacy, they tend to think about friends, family, teachers. So they have a very social concept or interpersonal concept of privacy. But if you ask adults about privacy, they often think about institutions or governments. So this conceptual understanding makes it sometimes hard to really connect. I'm thinking also about this call, where I think in the first 35 minutes we have used so many different terms, from citizenship to literacy to competencies, all terms that obviously can be perceived differently by different generations, but also across countries and regions. The second takeaway from our work is to really zoom into different issues and not let you kind of be blinded what seems to be the biggest problem at first. So again, in this kind of privacy field, we, at the beginning, when talking to young people, we felt like the biggest problem must be that young people are sharing too much information. So that must be the biggest problem. We need to give young people skills to be able to navigate how they deal with their information sharing. Turns out, actually, that's not where the biggest need is. Yes, young people need to benefit if they have skills in that space. But where they have the biggest blind spot is kind of around corporate tracking of their information and kind of what's happening behind the curtain. And so sometimes what seems to be the biggest problem at first may not be the biggest problem after all. So you really need to, in partnership again with young people, zoom in and dig deeper to really understand what's going on. And then maybe third takeaway is that in order to be really helpful or beneficial to young people is we need to look at the range of tools we have available. I work at a research center that very much focuses on policies, where kind of policy and law tends to be kind of a first approach, which is often a good idea. But I think equally important is that we think about educational approaches. I'm very excited about the topic of today, particularly because when we think about young people and the intersection with digital technologies, things move very rapidly, things change quickly. So the technologies change, but also how young people use the technologies. And so I'm a psychologist, but by the time policymakers and legal scholars tend to come up with these policies, often the tools have changed and the behaviors have adjusted. So policies and regulation is needed, but it's maybe not always the best approach. So education to me has been key in this work. So those are my main three takeaways. Thank you so much.
Thank you so much, Sandra. Really, very important insights there. I think one of my major takeaway was your second point where you were talking about data. And I mean, we're in a world where people online, young people online, their data is generated and collected and stored and maybe used by various entities contributing to the surveillance capitalism phenomena. So it's important to definitely equip them with the competencies required for them to navigate and prepare themselves for that. So thank you once again, Sandra. Interesting conversation so far. It will be very valuable to hear from our other speakers at this point. So I'll be handing the baton over to Andrea to kick off. Andrea, over to you now.
Thank you, Jamiwa, and I perfectly agree with you that the conversation so far has been really interesting, but I'm sure it will keep on at this level. And it's my pleasure to introduce Petrita Paul, who joins us today. Petrita has been involved in several activities. She's a global global champion for health, and she joins us today as a board member at the Imara Leadership Initiative in the United Republic of Tanzania, where they work to build capacity in action for results in good governance, health, welfare, leadership, gender equality, and peace building. So Petrita, thank you for joining us today. And I also had a way of reading that you supported with the support of Transform Health, you launched the e-health data governance manifesto in the United Republic of Tanzania. And I was wondering if you could outline the main demands of the e-health data governance manifesto you introduced, and maybe elaborate on the ongoing initiatives to fulfill these demands. Thank you in advance.
Thank you so much, Andrea, and I'm really delighted to be here amongst exciting speakers. I think we had a lot of insight from Sandra and Christine, and also just to give a brief of analysis of what we've done at Imara Leadership Initiative is we led a campaign that is a coalition campaign, My Data, Our Health, that is focusing on looking at the different ways we can have better health governance and the gaps of health data information to the citizens in the community. The initiative is well supported by Transform Health and it supports different countries, majorly in East Africa, but also works globally in other countries. So ideally, we had a series of engagements that we worked together in relation to ensure that different people in the community have access to their data, because health data information, it's quite challenging to get, especially in most African countries. And being that the fact that this is a global Public Health Week, and the whole concept is to ensure how well we can actually see the challenges of data information and health information to people. I think it's quite prudent to mention the work that we have done. So ideally, we outlined different parameters of work whereby we engage young people, parliamentarians, by the overall community in general. And this was through a manifesto that outlined about 6 demands that, first of all, they outlined the different areas that we would like the government and different policymakers to actually work on, especially customized for Tanzanian context, because ideally, we were implementing this in the United Republic of Tanzania. So one of the demands, just to mention a few, was to ensure that we have stronger health digital investment roadmap. As a country, we are actually going towards a new roadmap establishment, because the current digital health roadmap is expiring, but we are also looking at how best we can ensure the current digital health roadmap that is being developed meets the current digital demand. As we can see, there's a lot of media outlets out there, a lot of technology advancements, but we are not meeting up the targets and the demands of the new technology advancements. It doesn't make much weight that you can have a digital health roadmap that does not meet the current digital demand, especially if you look at the need to use different digital tools to access information, centralization of health patients' data information, etc. Instead of working on paper-based systems, why don't we move to electronic based systems? And one of the other demands was to ensure that we have a countrywide access of a government hospital management information system. So majority of Tanzanians and majority of the citizens in our country, and I'll take it as a personal experience from myself, if I get to a hospital in one particular region, my health information cannot be transferred to another region or another constituency, I can say, for some countries, or even another hospital per se, because of the paper-based system that we have. We do not have that mechanism where you can actually access any of your health information to several different hospitals that are working together at country level. So this has to actually change. And I think as we are moving into the new health digital era, but also the new public health order that we saw happen to see in Africa happening, we need to actually see a centralized system where we can have access to such information. But also there was another demand that focused more on education, on publicizing the afya systems in Tanzania. So afya means health systems. Majority of Tanzanians do not have access to education as some could tell. So I'll put myself in the privileged community or privileged society. Some do not even know that they need to access certain health information or health data. But it's not that they do not know, it's because they do not have that particular education in particular to be able to know that this is my right to access X and Y. So ideally, this is one of the key demands that we also targeted on. But I think the couple of 3 more demands focus on engaging parliamentarians to ensure that we have a stronger health data governance. We noticed that a lot of parliamentarians have strongholds, especially in parliament. They're the ones who table different motions. They're the ones who table different challenges that the citizens are facing. So in order to lobby for more stronger health data governance, we needed to work with parliamentarians. So currently we are working with some parliamentarians, but we need more parliamentarians on board, including those who are currently ministers, so as they can ensure they champion for health issues in general, but particularly with a strong focus on health data governance. But there's a need to access and improve the quality of health data. And I think this is one of our 5th demand that we had, that we have a lot of challenges of quality data in the country. And I think this also happens in some countries. But we need to ensure that there's a systemized way that we have enough information that has quality and sufficient data. You might not report that a particular region has high cases of patients of malaria or high cases of patients suffering from cholera or etc. Well, it's really not the case. So the data information has to be realistic on what's happening on the ground. But the last demand was ensuring we have enough financial allocation for the digital health sector. A lot of health sector is not well managed in a way that you have the digital element standing out. So since our focus was more on the digital concept, there's a need for more strong, sustainable financing for digital health sector. We've seen a lot of partners, a lot of institutions coming in, working on different projects, one off, and it's done. Once the project ends, that does not continue. But I think that can change by creating sustainability systems, whereby if you capacitate people on the ground, citizens on the ground, and this can be to any country in particular, it means the skill sets will stay in place and will still be transitioned from one generation to another. So I think those were our main key demands that we really focused on in the East African context, but also at a country level that we think could be adapted in other countries in particular.
Thank you, Petrita. I think that was really a deep informative response to the question. And so it's my great pleasure to thank you again. And then I will just jump to Andrew Jack, as we are a little short in time. So Andrew Jack joins us as the Global Education Editor for the Financial Times, and more specifically, the editorial lead for the Free FT Schools program. Can you hear me? I'm sorry.
Yep.
So thank you, Andrew, for joining us. And I would like to ask you if you could please provide us some insights into how the FT Schools program under your editorial leadership has empowered young individuals to become knowledgeable and responsible digital health citizens.
Yeah, thanks very much, Andrea, and great to be here. And first of all, now I focus significantly on education. In previous roles and with continuing interest, I also do a lot around health, including overseeing our involvement in the commission with the Lancet that obviously led to, amongst others, this initiative. And it's great to see that now flourishing with your new networks. And I think just picking up both from that initial work with the Commission and from some of the previous participants' comments, Sandra and Petrita, for example, it's very interesting to hear those wider trends being discussed as significant challenges. One around the practicalities of still limited access to digital technologies as a tool, whether for health or for education, for young people, amongst others. Some blockages around interoperability, some concerns about how to balance personal privacy of information with the potential important power of broader democratic access, if you like, to insights and to tools, and the value data, if safeguarded, can provide for research in a wider sense to benefit well-being and health outcomes. But obviously, as we heard also, I think very legitimately, there are concerns about corporate tracking and about influence and manipulation. And those are concerns both about the nature of the content and even the very nature of notably social media in general. And those are some of the areas that do intersect between the health areas of focus we've been discussing and the education areas, of course, that I'm also now extensively involved in. As you'll know, there's big debates, of course, at the moment, including a recent book here in the US where I am about the dangers, particularly for mental health, of young people around social media. And then the wider questions, of course, in this year of huge voting by people around the world in different countries about disinformation and the access to credible sources of insights as they try to engage with society. So these are some of the wider issues that touch on health and well-being, but also more generally around education. And I'll share just a few things that we've been doing, sort of following the initial work with the Lancet Commission. One area is a project we've got ongoing called Thriving Cities, and that's particularly looking at the role of young people in urban areas, notably in lower middle income countries, and trying to find interesting initiatives that use digital technology for their education or for their well-being and health, but also try to engage with them so that younger people are not just beneficiaries or participants in a sort of passive sense, but they're actually very actively involved in the creation and the governance processes. We also have an ongoing project called Health at Work, looking at very much sort of physical and mental well-being in the workplace and how particularly the sort of current Gen Z is being affected. And we've got also an ongoing project we're about to launch in a few weeks' time, a special report around AI. And as part of that, we've partnered with some other organizations doing a big online consultation at the moment with young people that's trying to poll their opinions and engage them in a sort of live discussion in multiple languages around both what role AI should play in education and learning, and also more widely around issues of well-being and climate as sort of two of the other key issues of concern for this generation. A final word, particularly on the specific FT Schools program, and I'm very happy to come back to that in discussions. But as you know, the FT is a high quality global source of news and analysis, not only about finance and business, but also about politics, policy, culture, and so on. And so a few years ago, we decided, even though most people have to pay for it, that we would offer pretty much all of that content online for free to young people still in secondary or high schools. And so one of my current initiatives is spreading the word and trying to work with teachers and students and other educational organizations so that both they're aware of this and can register to use the FT content, but also to kind of develop new insights and ways that that could be helpful in the future. And we do think at this period, at this time when, as I said, there's so much concern around disinformation, so many distractions, that it's really important to try to have that sort of high quality insight available to schools. So very happy to talk further about that. I've put some links in there as well to those things that I discussed earlier. Thanks very much.
Thank you, Andrew. Your presentation was at least as interesting as the others. And thank you also for disseminating this free FT Schools program. And so now it's time to hand it over to the audience. So please, anyone attending, if you have questions you're interested in submitting, you can please submit them through the Zoom Q&A chat function. But before them, I kindly invite participants to turn on their camera so we can take a picture. So if anyone participating can just turn on their cameras and we'll take a group picture of this event. I recognize some walking faces. So say hi, everyone. Okay. I think we're good. And I think we're having some questions popping up already. Tomiwa, do you want to jump in on here?
Sure, Andrea. Yes. Thank you all. So far, so good. To our speakers and for everyone for engaging. So the first question here is directed to Iman. So Iman, based on your experience as the regional youth champion for the DTH Lab, how can young people interested in this field rather be more involved and participate in decisions that shape their health and well-being?
Thank you so much, Tomiwa, for the question. I think based on my experience, I believe that young people that are interested in this field can be more involved by for example, building their skills, capacities, and staying up to date in general by educating themselves about different digital health issues, learning more about subjects like data privacy, AI, public health. These are all things that can empower young people to engage in discussions in a more meaningful way. I would also recommend volunteering and activism in general, like collaborating with organizations, institutions, or other stakeholders working in the field of digital health. Can be an amazing way to gain practical experience, contribute to interesting projects, and making a positive impact on their communities. Engaging, of course, in digital platforms, social media, advocacy campaigns. It allows young people to share their perspectives and ideas and even potentially influence decision makers and shape policies. And finally, I want to emphasize the importance and the power of partnerships and collaborations of building strong networks, working, for example, on your LinkedIn profile, sharing more about the work that you are or maybe already doing or are planning to do, and connecting with like-minded individuals. I think that these are all things that can help you amplify your voice and become more involved in digital health citizenship. Thank you.
Thank you so much, Iman. Thank you very much for that. Next question would be for Sandra. Now, Sandra, can you share any future directions or plans for the Youth and Media Project to continue its positive influence on enhancing digital citizenship amongst young people in the digital space? Over to you, Sandra.
Happy to share and hope we can all collaborate on these issues. 3 things we're doing. One is, as maybe also observed during this call, we are exploring what well-being means to young people. During this call, I observed ourselves using health and well-being kind of in one sentence, sometimes interchangeably, and making assumptions about what well-being maybe means to young people globally. So we're actually engaging in a mapping and use consultations to further explore the issue, because turns out well-being in the US means something very different than well-being in Colombia or in Thailand. And so maybe that's the first connection of what we're doing. Second connection is we're looking at what AI skills could be, or is it just skills in an AI world? So we're trying to distill that further and give some guidance. And in partnership with UNICEF, we're just currently designing a new study looking at generative AI tools, such as, for instance, ChatGPT, and how young people use those tools to solve tasks, including tasks around health, including mental health. And maybe the third project we're doing that is related to this call is we are hoping to provide decision makers, particularly in government and in companies, better guidance on how to work with young people, in partnership with young people. I think there is often kind of a shared understanding that this is important or valuable, but when talking to many governments, they don't really know how. And so we're kind of designing how-to guides for them that hopefully this will take place in more places around the world. So those are the 3 things we're doing, and hope we can collaborate on those.
Thank you so much, Sandra. Thank you very much. I can see Christine's hand is up. Christine, you may go ahead, please.
Yeah, just trying to bridge also the questions and answers here, and also what Andrew mentioned about mental health. So I come from Denmark, which is one of the happiest nations in the world, but we do have a flip side, and that is mental health among young people. And we do see a decrease, and worryingly, it's been after 2010, 2012. And the one strong indicator that shows up is the access to smartphones. So I think this is a trend we need to keep an eye on with all the opportunities, possibilities that digital options give us. I truly believe it helped to democratize knowledge and so forth. It also has a flip side. But think about it, when cars were invented, there was also fear about what cars would do. And now we can't really see a world without cars, but it's also one of the big killers. So as long as we still try to be critical in the sense that we've heard from Sandra as well, you know, how young people really are very considerate users of digital health. There are others who are not. And I think it's in our capacity as public health specialists to help pave the way so that we do not see that decrease in mental health and well-being. So this is just a call to action for all of us to be aware of the flip side.
Thank you so much, Kristen. Very well said. I can see Sandra's hand is up.
No, just a quick reaction to that. Obviously, it's a valuable observation. I just want to encourage us not to quickly make assumptions. So this is a question that keeps my daily life very occupied right now. There has been a lot of media for attention on this specific issue. And so we have to be, as health professionals, very careful not to draw kind of causality on it too quickly, thinking that mobile phones are to blame for mental health decline. There are lots of other inputs that we can draw from, like better measurements for mental health status, as well as other kind of complexities that are going on in the world that may impact young people's mental health. But I'm curious to hear from others. What do you think on this topic? And there might be other questions in the chat.
Thank you so much for that, Sandra. I think at this point I'll hand over to Andrea for any questions that might have been posed further on. So Andrea, over to you.
Thank you, Tomiwa. So I'll go back to Petrita, and I would like to ask you about some lessons that you learned that maybe you might be interested in sharing with young people who are interested in being more involved with governance processes at the local level.
Thanks, Andrea. I think one of the key lessons, many lessons that I learned on how young people can be more engaged at government level is to ensure that they work within the systems in line and look at your entry points. So you might be chasing after a wrong entry point instead of focusing maybe on the intermediate teams, let's say, that handle the policy issue. You might go directly to a politician or directly to another person who's not involved. So ideally work within the structures that are favorable for you, but also through the different amicable leaderships. Make sure you have your facts right. Make sure you have your information correct. I think that's the biggest backing point, because you might be going for something that is already there or it's existed. So a lot of research, a lot of information that is needed prior to engaging different local government or government institutions is quite key in order to reach your targets.
Thank you, Petrita. That's a really good point. I'd just like to comment on that maybe some young people, when they're trying to be involved in the governance processes, they might target the wrong level. So it's actually, what you're saying is actually really correct. And I'd like to dig deeper into that, but I'll jump to Andrew Jack. So Andrew, would you like to give us some insights on what's next for the FT schools program in terms of advancing educations and skills, or building with the tech focus for young people in lower middle income countries?
Yes, and just going more broadly and going back to the earlier comments, I mean, I agree about the thinking about the analogy with cars. I would certainly like to see a lot less use of cars. And in the same way, I think we certainly need to be a lot more thoughtful and mindful about the way we use technology. I am I think the power and the potential is great, but perhaps the overuse or misuse or the insufficient thinking and understanding of the safeguards and the downsides, including a disengagement with in-person activity and connection, is a matter that needs a lot more attention. Otherwise, we will be driven significantly by sort of corporate and commercial agendas, perhaps without sufficient reflection on the potential challenges that those technologies and the culture they're developing provides. A word perhaps and around the FT, but thinking also about the intersection with technology. I think, you know, what we've seen in terms of the development of generative AI, notably in the last few months, is highly transformational, but again, needs then a lot of thought about the preparation for tech education. You know, I think for a long period there's been this sort of obsession with coding camps, for example, and I think you know, we should be very cautious about going down that route, because frankly my prediction is within very few years most coding will actually be able to be done with a very simple set of requests to AI systems. And therefore, while we need to provide some basic vocabulary and familiarity with technology, we should be very careful about thinking of that as the magic solution. I think for education as well as for well-being, we need to think a lot more in schools and in learning more broadly about maintaining and rebalancing social emotional skills and around critical thinking skills, for example, as keys to a thriving future and potential. As to the FT and its schools program, well, I mean, certainly we will continue to provide a lot of coverage around technology and around health and well-being. We have a report due out at the end of May, as I mentioned, on AI specifically for those who are in school. I'm in the process of writing a piece actually on happiness and alternative ways to measure growth and prosperity. And then more widely for our schools program in particular, we're very keen to expand it further. We're doing a lot in South Africa, for example, and India, amongst other places, significantly English-speaking countries where there's a real value in trying to improve equality of access and broader access to high quality information. And so very keen to spread the word on that. And as I said, finally, and as part of this AI for Schools initiative, I would certainly encourage, you know, many of you to take part in the consultation, the link I mentioned there, as part of these wider initiatives to really understand the perceptions and the practical uses and the views of technology and health by this coming generation. They're certainly going to be important topics for us going forwards.
Thank you, Andrew. What you mentioned is extremely relevant, and I'm sure we'll have a chance to chat more about that. But then I hand it over to Tamiwa from here.
Thank you so much, Andrea. Thank you, everyone. And thank you to our speakers as well. This is to our speakers in just about 30 seconds for each of you. Could you please give your closing statements as to where do we go from here with regards to advancing digital health and civic citizenship for young people and youth generally? We'll start with Christine and Iman and Andrew, Petrida, and then Sandra. So yes, in 30 seconds, please go.
Thank you. I believe that we should move forward with curiosity, less than fear, and try to design solutions that indeed help us to be empowered and then avoid these pitfalls that has been mentioned.
Thank you, Christine. Over to you, Iman.
Thank you, Tamiwa. I want to also to say how grateful I am for this opportunity, and I want to thank all the speakers and participants for their valuable insights and contributions. I think it is very evident that advancing digital health and civic literacy is a complex but crucial endeavor that requires a lot of collaboration and innovation. So for me, as for the next steps, I would say the most important thing is to remain committed to the collective goal of not only building our own capacities and empowering ourselves as individuals, but also the communities that we are part of, and to take the knowledge and inspiration as well gained from this discussion today and turn it into action. Thank you.
Thank you, Iman. Thank you very much. Over to you, Andrew.
So I think on the one hand, in many parts of the world, we still have to be mindful that there are huge issues of access, limited access and unequal access to technology and to broadband. And therefore, there's a real opportunity and a need to ensure fair and equitable access to technology. But I think that needs to be combined with mindful and responsible use. So it has great power, including building networks and providing information, but we have to think very carefully about the use of data, about the overuse, and about the quality of information and insights that are provided and the agendas of many of those who are providing resources and information and collecting data from users and driving behaviors that may be of some concern. So we need to level the playing field, but we also need to think very carefully about the nature of content, and particularly in this post-pandemic world, also think about reinstituting much more human in-person contact.
Thank you very much, Andrew. Over to you, Katrina. Please, you have 30 seconds. Thank you.
And thank you so much. I won't repeat what my colleagues already said. I think one thing is quite clear. We need to ensure quality of data and accessibility due to different backgrounds and communities. But I think I'd like to cement on one thing, that power of collaboration is key, and ensure that we work in synergies rather than in silos. That's all.
Thank you, Katrina. Last but definitely not least, over to you, Sandra.
Thank you so much, and thanks again for the invitation. I share some observations with Christine and Iman, but 30 seconds. So whatever we do, we should do it in partnership with young people. And that's why I'm really excited about this initiative. Thank you, Whitney. Thank you, Tomiwa, again. I think it's really meaningful, the work you're doing. So thank you for having us.
Thank you. Thank you very much, Sandra. And then next on the agenda is over to you, Andrea, and you, Maya. Please, you have about 5 minutes before we move further up. All right. Thank you, Andrea.
Thank you, Tomiwa. And it's my great pleasure to introduce Maya Farfeh, who is a medical graduate from Tunis and holder of a master's degree in public health from the Université Laval in Quebec, Canada. And she's currently engaged as a graduate research associate at the CHU, the Quebec Research Center, where she's committed to fostering a more equitable access and accessible healthcare landscape. And today she'll be presenting our activities on the advancing digital health and civic literacy through intergenerational dialogues, and more specifically, a literature review on digital interventions to target health literacy. So please, Maya, the floor is yours.
Thanks so much, Andrea. I'm really happy to be here with you today to present our work. So it's kind of a challenge for me to do it in 5 minutes, but I do my best. So just quickly, I'm presenting our work today about our digital health interventions impact on health literacy. And it's a systematic review. As you can see here, we are an international team, and it's so rewarding for us to work together. So in terms of the background and rationale for doing this, we all know that health literacy plays a major role in public health outcomes, especially in this digital era we are diving into, and where information has become really abundant and so easily accessible. So as you probably know already, there's a variety of digital health interventions, ranging from multimedia tools and telemedicine to AI. And all of these interventions have been employed to improve health literacy and patient outcomes in general. But there's a literature gap here regarding both the scope and effectiveness of these digital health interventions when it comes to improving health literacy. which leads me to our objective here, which is to examine digital health technologies that are designed to enhance health literacy and explore their development processes, as well as their adoption patterns. So we've talked this morning about, or this afternoon for some of you, about digital health and health literacy. We just adopted the WHO definition for digital health and the CDC health literacy definition within the scope of our study. So as for the methods for the PICOT, for the P, we were focusing on any population. We weren't really restrictive. As for interventions, we were focusing on any technological intervention in digital health that meets the WHO definition. We weren't restrictive regarding comparators. And for the outcomes, we were focusing on any outcomes that are related to health literacy. We did our search starting from 2013 till 2023, and it's really important for me here to flag the fact that we're using the PRISMA review for reporting guidelines. Could you please mind turning your micros off, please? For the data selection, we were focusing on 3 databases, our PubMed, Institute of Electrical and Electronics Engineers, as well as the Association for Computing Machinery. And we also applied the filter from 2013 to 2023. So as for the article screenings, obviously we use some inclusion and exclusion criteria that we defined so well. So we included articles that are meeting our PICOT that I predefined early in the previous slides. As for the study designs, we were including any original research, cross-sectional studies, surveys, case reports, and any other types of primary studies or reviews, commentaries, as well as observational studies. And thanks to our multicultural and international team, we were able to include studies that are in English, French, German, as well as Italian. So the screening process, what we did is we took all the articles and we screened based on their titles and abstracts using the PICO. And we also we did it on the Ryan platform. Really important for me here to flag that this review process was double-blind, and any conflicts that arose were resolved by our leading team member. So in terms of the framework definition, I'm talking about the extraction grid here and the variables of interest in our study. We based our extraction grid on the WHO classification of digital interventions, services, and applications in health. And the reason why we based our choice on this is because first it's led by the WHO, so it's kind of trustworthy source. And we also thought that this is the most accurate framework to adopt within the scope of our work. But just to ensure that all the variables are meeting our needs, we did also run a pilot extraction. So just to be sure to include any other potential variables that would be of interest to us, for example, like health equity components or misinformation components, etc. So of course, I'm not gonna go through all these variables that we are including in our extraction grid, but they're based on the framework that I presented in the previous slides. As for the full text extraction, we did the same process basically as the selection phase. And again, it was a double-blind process. So which this takes me to, I guess, the most interesting part here, that is the preliminary results. So our search yielded 1,029 articles. Out of these, only 88 articles were eligible for full screening, full text screening. We removed 30 duplicates, and in the end, we included 58 articles that are eligible for full text extraction, and that's exactly where we're at right now. So in terms of the next steps, obviously we will complete the data extraction phase. Then we'll synthesize the findings using a narrative approach. We'll also compose and hopefully publish the manuscript. So why are we doing all this? Because we believe that conducting the systematic review would be really useful in terms of next steps. First, to fill knowledge gaps. So our work would provide some fresh insights into the efficacy of digital health interventions. on health literacy. And it's really important for us here as we didn't restrict any populations. So our work will give us really important insights across diverse demographic groups. We will also think that our work will help us address the digital divide. So by focusing our recommendations on our findings, we're planning to bridge the digital divide and also to ensure some more equitable access to health information and services for all patients. And finally, we really think that our work will advance us and help us make really strong strides to give some evidence-based recommendations to help ensure digital strategies become most effective in enhancing health literacy as well as patient outcomes. Thank you.
Thank you, Maya. I think you have presented perfectly our work here. And I'd just like to compliment on that. Would you like to give us a two-liner with some preliminary results, maybe some particular interesting study you have seen?
Yeah, sure. Since you're based in Italy, Andrea, I'm going to give you an Italian study. So basically what they did, it's an interventional study. So what they did is take a cohort of medical students and they kind of crafted an intervention based on informatics course. So they wanted to know if putting this course online and giving it to medical students will help them improve their skills when it comes to data management and patient information management. So they use like the basic tools to assess digital health, which is eHealth, and they noticed that their course was really effective in terms of improving eHealth literacy in medical students.
So thank you again, Maya. I think this stresses the importance of involving young people and dedicating time and resources to education. So I'll hand it over to Whitney from here on. Please, Whitney.
Yes, wonderful. Thank you all so much. I think I'm tasked with a brief closing and then a little launch that we want to do. I realize that we are now 7 minutes over, and in Switzerland, that's like everyone go home, we're done. No one can do that. So a big thank you for anyone who's stuck with us. I swear I will be brief and take 2 to 3 minutes, okay? So first off, a big thank you to our partners at the Young World Federation Public Health Association, especially Andrea for helping to moderate, Maya for joining with this this briefing that she's just shared, and then of course Alessandro, who was unable to join us but has been really the leader and the driver of this work and the larger collaboration with the lab. So a huge thank you to you all for joining us. Also, of course, to the participants and the speakers. If you can't tell, it was really a chosen selection for each of the speakers who were on today's intergenerational dialogue. We really wanted people from different professional fields of interest, professional work, but also a diversity of backgrounds. So hopefully, as an attendee, you were able to see that we've got people from the civic space, we have people from the health space, people from the digital citizenship, but also kind of that education and literacy side as well. Because this really highlights the multidisciplinary and multi-sectoral approach that the DTH Lab hopes to convene and able to support this work moving forward by young people. So digital health citizenship emerges from this intersection of digital transformations, health, and citizenship. And I really like that Sandra brought in this idea, more than idea, this, reasoning behind our need to really get at what these terms mean, what they mean to different people, different geographies. And so I will be following up with you, Sandra, just flagging that. So we actually do it because we're a bit famous for that. But so it's really about this convergence of this, triangulation of the three areas. And today's session really aimed to provide an overview of kind of current activities and trends of interest aimed at improving this digital health and civic literacy space with young people. So we heard about specific work at the country level, current objectives to improve civic participation with young people, current projects that are underway to advance health literacy, but also in the digital space and in the citizenship space. And we also heard about, current trends and tools, challenges and risks, but then also this drive of the opportunities that are still there and that curiosity to really go out and get them. So I really appreciate everyone for today's session, and I'm very excited to share with you the launch of a digital health citizenship online survey. This survey was in partnership with young people, as well as the partnership with Young World Federation Public Health Association. And it really aims to assess young people's perception of digital health citizenship. We encourage you all to kind of follow this QR code and complete the survey. The findings from the survey will inform the work of the lab, including the development of an online toolkit. So this toolkit will then also be in collaboration with different youth-led organizations, but also with the regional youth champions of the lab. And we will come to different decision makers and stakeholders, some of the speakers who were present today, we will follow up with to help us support in that creation of the toolkit. So by involving young people who are growing up in the digital world as key agents of change, the DTH Lab's work is responsive to young people's health priorities, and it supports co-creating relevant solutions for improved health and well-being. I thank you all for joining us today. As I mentioned in the very beginning, this is going to be a series of dialogues and debates. We got some fiery passion in there today, which I really loved and wanted to go into a whole telenovela together. But we want to bring that more. We want more dialogues and more debates with young people to see kind of where we move forward with the digital health citizenship space. So thank you so much. Thank you for our moderators, and wishing you all a wonderful rest of your day. And please submit your response to the survey. Thank you again. Have a great day.
Thank you, Whitney, and thank you to our fantastic participants. And thank you to Miwa. Have a good day. Bye-bye.
Bye-bye.
Thank you all.
Thanks, Andrea.